Thank you for taking the time to review our proposal for the community of Angalsi. A little bit of background about who we are. We are from the Save Lives Maternal Child Health and Nutrition Division. We have a long-standing experience in aid programs focusing on the welfare and maternal welfare of children and women. We believe that engaging directly with the community is our best approach for longevity and health and well-being. Upon researching for this campaign, an alarming statistic we discovered was that approximately every 2 minutes a woman dies during pregnancy or childbirth. What was more alarming is that most of these deaths are preventable. Our mission is to reduce maternal and newborn mortality rates, and we believe that every mother is being able to provide it with optimal health and has the right to bring a healthy child into this world. Our proposal summary is as follows. The prolonged drought has crippled the community of Anglesey. As a result of this, we would like to create a community health workers network to improve and enhance the capabilities of the medical system. We believe that we can do this through education and training programs, and our ultimate goal will be to improve maternal and child welfare throughout the region. There are various number of health issues that are associated with the prolonged drought. Food security, malnutrition, sexual health and family planning are key priorities for us. We will work alongside other NGOs to roll out a program that will have a long-lasting impact, and we will ensure that the Community Health Workers Network are trained and upskilled to deliver appropriate medical treatments and practices. Background to the situation is as follows. It's been approximately 3 months since we provided an effective short-term recovery approach to the community. It was a weak infrastructure, there were conflict on the border of surrounding countries, and majority of the community were at risk of famine. Through cash transfers and nutritional relief and enhanced sanitation practices, we were able to shift the community from an emergency stage to a stressed stage 2. The response was effective, but we need to implement a long-lasting, resilient plan to improve the community's well-being. Our key priority is access to healthcare, whilst also ensuring that water and sanitation and food security services are enhanced to ensure the program is effective long-term. Our lead organisation will be as follows. Education is our way of communication, and we believe that with the right training programs, we will be able to pass on our legacy of sustainability to the community once we depart. We believe that upskilling the community health workers is essential to improve the maternal and child welfare treatments, as well as ensuring that the medical aid is delivered upon the completion of the project. We will also work alongside other NGOs such as WaterAid to ensure their community-led total sanitation program is impacted and executed effectively. Our recovery needs of the project is highlighted here. Healthcare is our priority, and we believe that it is up to us to provide the accessibility to the right healthcare and education programs for the community. We would like to think that we would just not provide on-the-ground medical assistance, but also create a long-term holistic approach and to ensure that the community leads the program upon our departure. Promotion will come into play quite heavily, especially in areas of sexual health, nutrition and psychosocial resilience. We would like to empower the community to not just be a part of the Community Health Workers Network, but to seek treatment themselves and have confidence within the system. The Community Health Workers Network will comprise of individuals that will be supervised and observed over a 12-month period so they understand what systems and procedures need to take place when providing medical assistance. In order to establish the Community Health Workers Network, we will need to select and identify the appropriate people within the community to participate in the network. We know that strong incentives will be required to get people on board, and we also know that if we create a social setting and a safe platform for the people to discuss their concerns, emerging trends and the priorities within the network, that will provide a safety net and a support group in a social and relaxed environment to ensure that there's confidence within the team to execute the appropriate medical procedures. Here is a snapshot of what the Community Health Network will try to achieve. They're broad subjects, but the overarching elements are education support for women pre and post-pregnancy, immunisation and vaccination programs along with health checks. Sexual health education is essential to understanding and learning how to prevent the spread of sexually transmitted infections. The development of the mobile service clinics to ensure that they are located in an area that's close to town, making it convenient for women to attend and making it easily accessible for people to travel to the clinics. We understand that due to the prolonged drought, there will be some psychological impact for women that have been impacted by domestic violence. We will need to make sure that members of the community health network are not just skilled at providing medical assistance, but also have the ability to provide psychological support too. We will also implement the WASH program and education on how to improve and enhance sanitary practices. Our number one objective throughout this campaign is to ensure that we leave a community that is self-reliant, self-empowered, and sustainable. We want to make sure that the community is able to plan, prepare for future disasters and to mitigate the health risks that are involved. Our number one priority is to improve access to healthcare and to empower the community to lead the programs and to increase the number of healthcare workers. Our recruitment and training practices to recruit the right people for the Healthcare Workers Network will be taken into consideration based on recommendations by people within the community. And we will collect data from attendances that have visited the mobile clinic and monthly recordings to ensure that we're on the right track. We will survey the team to find out why or why not people may not be accessing the healthcare system, and we will use that data to plan for the next phase. Our exit strategy is just as important into the implementation and design of the program than it is our mission statement. We believe that in order for the Community Health Workers Network to really have a long-lasting impact, we need to make sure that we create a dialogue with senior management within the Community Health Workers Network and that we have ongoing communication and monitoring with regular meetings to ensure that all the hard work that we have done to create a sustainable community is not forgotten. We will make sure that we create what we call a bridging period between the 2 to 5 years in the completion of the project to ensure that members of the community, if they need any assistance, that we are available on standby. Constraints and assumptions we see is community engagement. We understand that this project has never been implemented within the community, and we understand that there might be reservations and hesitations from the community leaders and members to participate. We know that Save Lives has good intentions, and we know that we are in the right place with the right framework to create a strong network. And just reiterating, the strength in partnerships with other NGOs and local government will be imperative to assess the risks. If by chance a scenario increases and intensifies over the border with refugees, we will make sure that the Community Health Workers Network are well equipped and trained on how to deal with that on demand. In the event that this proposal isn't endorsed, we fear that the community of Angalsi will be at risk of falling back into a state of an emergency and prolonged drought. We would like to see this community thrive and believe that with the right education programs and the right management and leadership, this program can be executed effectively. Thank you for taking the time to review our proposal. We look forward to hearing your feedback.